Hi there, I'm Alex from the Medical News Bulletin, bringing you the biggest medical news of the week. Visit our website, www.medicalnewsbulletin.com, for daily updates. You can find the link at the bottom of the screen. First up, we will be talking about how proper planning when designing urban living areas can impact mortality rates. By 2070, almost 70% of people worldwide are expected to be living in urban areas. Urban areas like towns, cities, and the suburbs provide easy access to social interaction and services and goods, but they also expose habitants to high levels of air pollution, noise, and heat. These factors all negatively impact health and can also increase overall mortality. A new research study has estimated that mortality in urban areas could be reduced by 20% if urban area planners complied with international recommendations for noise, heat, green space, and pollution standards. Residents would live an average of 1 year longer, saving 9.3 billion euros annually in health-related costs. Tuberculosis is a lung infection caused by an airborne bacterium. Easily spread through coughing, sneezing, or spitting, tuberculosis continues to be a very big health concern around the world. The Lancet journal recently reported that the number of drug-resistant tuberculosis infections in children may be higher than previously thought. Using stats from the World Health Organization, the study estimated that 67 million children worldwide are infected with tuberculosis, and 5 million of these cases are resistant to the most common first-line drug. And now for a topic that many people are trying to wrap their brains around: weight loss. Many of us are struggling to lose weight, keep the weight off, or prevent adding it on. With so many diet plans and exercise programs out there, it can be a little daunting to try and find out what really works. A new study could help you with weight loss plans. Researchers reported that increasing exercise rather than dieting or cutting back on calorie intake is the best way to lose weight. Keeping calorie intake high but increasing exercise rather than just cutting on calories showed the biggest weight loss in this 5-year study. Colorectal cancer, or cancer of the colon or rectum, is the third leading cause of cancer-related deaths in the U.S. By the end of this year, almost 50,000 people will pass away from colorectal cancer. Because about half of colorectal cancer patients die within 5 years of diagnosis, efforts to improve survival are very important. Following a 5-year study, researchers have reported that colorectal cancer patients are more likely to survive if they are light drinkers. The study found that those who completely avoided alcohol, or those who were heavy drinkers, actually had the highest rates of colorectal cancer mortality. Researchers suggest that the protective effects of light drinking may be restricted to wine. That's it for today. Thank you for joining this week's episode of Medical News Bulletin. We hope you enjoyed hearing about the latest health news.